orthopedic exam, but I tend to really literally just go from like nose to tail. So you're making sure that there's good extension in the shoulders. You're making sure there's no thickening of the elbows or the carpus, which is their wrist. Some people call it the knee. It's only called the knee in horses, but sometimes it kind of like translates over, even though it's different. And make sure their feet feel okay. Some animals are known to get what are called interdigital cysts, or little swellings in between the tootsies. You know, boxers, bulldogs are kind of your typical breed. And you make sure that there's no swelling of the joints called effusion or crepitus, which is like creaking in the joints, and there's no bone pain. So we want to make sure that there's no overt arthritis or any other underlying condition. And you'll also, while you're doing that, note to see if you grossly feel any difference in the size of the muscles between the two front legs. And then you'll take your hands and you'll run basically all around the trunk of the animal. So the chest, the abdomen, and you're going to go like 360. And the point is you're feeling for basically lumps and bumps. So you want to feel for any growth that could be on the skin or under the skin. And then if you find anything, sometimes people will say, oh, this lump under the skin feels like a lipoma. And a lipoma is a fatty growth. We actually think it's more altered fat metabolism than it is like a true tumor. And they're usually benign. And sure, sometimes things feel fatty, but realistically, the only way to know what it is to stick a needle in it, collect some cells, squirt it on a slide, and look at it under the microscope. And that's how you diagnose a lipoma. I've certainly said, hey, it feels like a lipoma, and then had people decline for me to do a fine needle aspirate, but the only way to definitively diagnose it is for us to do the fine needle aspirate. And you can also, at this point, while you're feeling, you'll observe the coat, see what the coat looks like. Are there any areas of hair loss, any redness, any damage to the skin, any scar tissue? We have some fair number of snake bites around here, so sometimes you'll see scarring from previous snake bites, or if we have like a rescue greyhound, they usually, unfortunately, have scars everywhere because they're just very fragile. And then I usually listen to the chest. So with my stethoscope, I am going to listen in 4 areas for the heart. So basically the left and right armpit area, and then I'm going to go back a little bit farther. And then for the lungs, you're going to want to listen to 4 spots on either side of the chest. So you're going to want to listen in the front part on the bottom, back part on the bottom, front part of the top, back part of the top, and you're going to do that on the left and the right. And if they're panting really heavily, you're going to need your assistant to hold the nose closed. Sometimes like they're just too excited, and like bulldogs, like they're going to act like they're going to explode if you try and stop them from panting, or Shih Tzus too. And so I'll have the client the assistant or technician literally do like a quick like blow in their face, because it distracts them and it makes them stop all of a sudden, and then I can listen to the heart for a couple of seconds. And I'm not even going to lie, when my kid was born and he would start screaming for no reason when he was like an infant, I tried that once where I did the quick blow, and it totally worked. And he stopped and he calmed down, and I did it at the pediatrician's office, and she just gave me this look, and I was like, what? It distracts him. I mean, it's not that I'm being mean. It just is like a, quick external stimuli that gets him to stop focusing on the screaming. So I'm not advocating anybody try it. I'm just saying that it worked. So we're listening to the heart and lungs, and I will frequently listen to the lungs with them panting and then without them panting. And then I'll often take my stethoscope and I'll listen over the throat area, because sometimes it sounds a lot harsher, and especially in animals if they're getting what we might think is laryngeal paralysis, or it's a weakness basically of the larynx area. It'll sound like that noise, and so you can often appreciate it better when you use your stethoscope. And then we will do an abdominal palpation. I guess not we. There's not multiple doctors in there with me. I mean, sometimes there are if there's somebody visiting or there's an interview, but usually it's just one doctor doing the exam. So I'll do abdominal palpation, and the best way for me to describe abdominal palpations are if you took like a Ziploc bag and you put 2 Roma tomatoes, okay, so those are the kidneys, and then a bunch of just like giant egg noodles that are cooked in there. And that's really what you're feeling, right? So when you do a belly palpation, that was one of the hardest things, is you have to feel 100 normals so that you know what abnormal feels like. And sure, you can get to the point where you're like, oh, I'm feeling the edge of the liver, I'm feeling the spleen, I'm feeling the kidneys, and then you can tell, especially in kitty cats, if the kidneys are smooth, if they're round, if they're big, if they're small. And then when you feel the intestines, you're, feeling for like sometimes foreign bodies if you think they ate something, or any thickening. It's rare to feel like an enlarged lymph node or gland in the abdomen. And then you're feeling for the bladder itself just to make sure that it feels normal. And again, in the end, it is a somewhat unspecific test, but it lets you clue into if there's a problem. So for instance, let's say I have like a 10-year-old male neutered German Shepherd that I'm doing a wellness exam on. And all of a sudden I feel something like a softball in the left front part of the belly. Well, that's where the spleen lives. And so that's going to make me, given the breed, because German Shepherds like to get splenic problems. Doesn't necessarily mean it's cancer, but they like to get lumps on their spleen. And so that's going to make me say, hey, we should get an x-ray. And on x-ray, you're going to be able to see things a lot better. You're going to be able to evaluate like the contour of the liver, the size of the spleen, if there's a mass, as well as the intestines. But knowing what normal feels like is what allows you to say that it's abnormal. It doesn't always mean you're going to have an answer right then and there. And I think sometimes that's frustrating. But realistically, a lot of the steps in medicine are, okay, is it normal? Is it abnormal? If it's abnormal, what do we do next? And that is one of those big helpers, I think. And you can also appreciate pain on abdominal palpation. So if they have like a bladder infection or stones or crystals, in cats that get, I think now they're calling it feline interstitial cystitis, which is like a sterile inflammation of the bladder. Sometimes they can have infections. Sometimes it can be due to crystals or stones. You can appreciate that. If they have pancreatitis or inflammation of the pancreas, sometimes they'll be painful. The one thing to keep in mind is that back pain does refer to the belly. So when we push on the belly, they're inherently going to kind of like do almost like a dog crunch and tighten their core. And that's going to put more pressure on their mid to lower back. So if they have back pain, whether that's neurologic or muscular, you may notice that they seem uncomfortable because of that. But another thing to keep in mind is dogs and people have groin muscles. And the group of muscles we refer to in dogs is the iliopsoas. So it's the iliacus and the psoas major. And it starts around L4, L5, so the 4th, 5th lumbar vertebrae. And then it travels kind of along that area and then inserts on the inside of the head of the femur or the thigh bone. And if you're really like jabbing up in there when you're doing your palpation and they have like a pulled groin muscle or a painful groin muscle, they're going to act painful. And sometimes people think it's belly pain or think it's back pain, but it's really just because of where that muscle inserts. So if I'm doing an abdominal palpation and I get farther back and I'm touching that area and dogs start to splint, I worry that they then have iliopsoas problems, which can present as lameness. And so then I kind of go on a whole other mission to see if I can figure out if it really is the iliopsoas. But a lot of times people mistake that for belly or back pain. So now we are at the back legs, and similar to the front legs, you're going to want to make sure the hips and the knees have good flexion and extension. There's no swelling in the knees or thickening. The hocks or their ankles, you also want to make sure that there's no swelling or thickening and there's good range of motion. Same thing with their digits. And then you're going to look at the tail. Some animals normally will have a kind of like bald spot on the outside of their tail about a third of the way down. And there's a gland that lives there. And some animals, for some reason, it causes a little bald spot. And in intact male dogs, you see that a little bit more. You also want to lift the tail and make sure that the outside of the anus looks normal. And you're also going to check to make sure the skin and the fur on the tail and the back of the legs looks good. And then I usually run my hand kind of almost like bouncing up and down along the spine, usually from the pelvis up to the base of the neck. And that helps me just make sure there's no areas of pain or discomfort in the spine itself. And that is basically your whole exam. In cats, it's a little bit different. Like they really, for some reason, hate it when you try to extend their hips. I think it's because they're in this like crouched up position and they really don't want to move, and then you're making them move. And then I also always make sure I kind of roll kitties to the side so I can look at their tummy, because a lot of cats, if they have like a painful belly or they have other issues, they'll start over grooming and they'll get bald on their belly. In dogs, I make sure I look at the belly too. It's just usually you can see it a little bit better. You don't have to like roll them on their side. And with cats, kind of going back to the beginning where we talked about watching them walk around, I try. It's really, really hard because usually they either like run into their carrier or they just hide under the chair. So you get like 3 steps of crouch and then they sit or they lay and they just kind of stare at you, and they don't really want you to watch them walk because they would rather be hiding. So doing a visual orthopedic exam on a kitty cat is a little bit challenging. A neurologic exam is always, at least in part, incorporated. So part of that we talked about was like the eye symmetry, making sure that the pupils are responsive to light, making sure they're visual, making sure they can hear, making sure they're not circling or stumbling. And then if I think there's a neurologic issue, I'll go into a more full, complete neurologic exam. So I hope that kind of sheds a little bit of light on what we do when we do our exam and why it is that we're so systematic about it, and how it helps us kind of clue into details. And when I do the integrative medicine, when we start talking about Chinese medicine and some other podcasts, you'll see like some other things that I feel for. Like I'll feel pulses on the inside of the back legs. I use that to help me with my Chinese medicine diagnoses. And then I'll feel for acupuncture points. So I'll do acupressure with one hand while still feeling the femoral pulse or the pulse on the inside of the thigh. And responses to different acupuncture points help me determine my Chinese medicine diagnosis. But we'll talk about that all more in another installment. So I hope that helped kind of explain our rationale for the exam and why it's so important. And as always, if you guys have any questions or you want to know more about the veterinary physical exam, just let me know. I think that about wraps it up. As always, thank you for listening to this installment of Vetsplaining. I hope you enjoyed your time with me and ideally learned at least one new thing for the day. If you have any questions or suggestions for future topics, feel free to leave a comment below or email info@independenthillvet.com and put podcast topic or podcast comment in the subject line. Until next time.